first question is, what's a real-time health monitoring system? I heard you guys speaking at the launch, but it would be great if you could give us an explanation to that.
What we have is a system that is able to remotely monitor the vitals of a patient, whether he's in the hospital or he's in a recovery care center, as such, by using a small patch that can be placed on his chest, and that monitors all of his vitals, like it monitors his ECG, heart rate, respiratory rate, pulse, and then it also has another system that can be placed on his wrist, which also tracks his oxygen saturation. The patch also tracks his posture, so if somebody will know if he's kind of falling down or something like that, right? So these vitals are then fed into what we have is a care communications platform. Honeywell has a care communications platform, which is a larger platform, right? Which is used to call nurses and communicate with nurses and stuff like that. What this does is that it just doesn't communicate, it also feeds in real time continuous feed of vitals to that app. So the nurse can actually see what is happening no matter where she is. And
Okay.
if there is an excursion in the vitals, like if it breaches the upper or lower limits, it sends an alert to that app, so the nurse can actually come and attend to that patient. So doesn't have now come like every 7 times a day to connect the vitals and go back, right? So you have it in once available. Finally, there is a nurse station, right, that you would have seen in a hospital, and they have a monitor, right?
Yeah.
So there's on that desktop there is a visualization of the vitals of all the patients in that ward, right? So there's a dashboard that has patient A, B, C, D, and then all the various vitals, and everything is green, all okay, but there will some that will turn red if there's an excursion. So the person sitting at that station can actually see what is actually happening in real time, basically. So that, in short, is what it is.
Okay. So how does it actually work? What's the technology behind this?
What we use is a sophisticated sensor-driven technology that is actually in the piece of hardware that actually goes into that patch that actually monitors the vitals. And what makes it unique is then it kind of connects to our very sophisticated software platform, which is based in the cloud, where the patch actually connects to the internet. That's all it does, right? To the Wi-Fi. And once it does that, it comes to our software layer where we are able to kind of take that data and basically then visualize that in different form factors, whether it is in the app or whether it is in the desktop or the nurse station environment through a cloud platform, which is built by us for this particular solution.
Okay. And what are the vitals that can be tracked by RTHMS?
RTHMS tracks ECG. It's a two-lead ECG. It tracks pulse. It tracks respiratory rate. It tracks heart rate, posture, and oxygen saturation.
And what all operating system is the app compatible with?
It is compatible with an Android phone as far as the app is concerned, not yet on iOS, but we will be working towards that shortly. So it is compatible with the Android. What we found is that we are doing it primarily for India right now, and we want need for speed meant that we want to address the maximum segment, and a lot of people are on Android phones. So it basically caters to that. It also caters to purpose-built phones that Honeywell itself sells. It's called the EDA series, right? So we have our own hard devices that are really rugged. You can really drop them, nothing happens. Those kind of rugged devices, right? So we it is compatible with those as well. If somebody wants to buy those devices, this is like already integrated into that device. And then it is an internet browser, right? The workstation is an internet browser, so all your major browsers are supported, and then it just operates on that.
Okay, in during the launch, you mentioned about integrating it with the phone and all. So, is one device can be integrated only with one phone, or it can be nominate, or it can be seen by the doctor as well as the nurse?
Yes, it can be seen by both. And this is basically a cloud solution. So any number of people who are authorized, so there will be an admin privilege that will be given to who can see what, and based on that, people can actually see it.
Okay, and what about the data? I presume it is being collected real time, and what are the securities assigned to it?
So what we have done is that patient privacy is to the core of us. So we don't know, or this software will not be able to attribute the data to a patient who is identifiable. So it will attribute it to the bed, right? So the job of actually collating that bed information with the patient information is with the hospital. So we don't try to touch that data. So we try to stay out of the perimeter of the privacy that actually governs it. So we try to stay on this side. So we will let the hospital figure out how they do the correlation in their reporting structures and their HIMS and stuff like that. So we kind of stay away from that particular realm, right? So that's how we actually operate in this.
Okay, so you mean to say that the data will reside with the hospital and not with Honeywell?
Not with Honeywell. So
Okay.
the data that resides with Honeywell is the data in the cloud, which is non-attributable data. So you can't do anything with the data. It's a data that's associated with the bed number.
So
It does
once a
not make any sense. Yeah.
okay, once a patient is discharged, the data is useless in terms of anyone if anyone tries to hack it. Is that what you mean?
Even if the patient is there, the correlation of who the patient is to the vitals is there only with the hospital. We don't have it.
Okay.
We have the vitals of a bed. We don't know the vitals of the patient, to be very honest, right? So that correlation happens only with the hospital. So it's the hospital that has to decide how they deal with that correlation. So anybody who sees the vitals is just vitals data. It doesn't have age, it doesn't have name, it doesn't have address, it doesn't have anything, right? It just has a bed number and it has the vitals that are associated with it.
Okay. What kind of health facilities can avail this product?
Couple of healthcare facilities can avail this Sujata. I think one is definitely the hospitals where people are there. Like, for example, converting a regular bed to a smart bed, right? Like I was explaining, right? That really doesn't need these complex attachments that come in, like, so hospitals. Secondly, continuum care centers, like Nandu was doing this panel discussion with one of the folks called, he was actually a founder of a continuum care center called Sukino, right? Where people who recover from hospitals go there for convalescence to kind of get better, or somebody can't be taken care of home for a long time, so they stay there. So those kind of continuum care centers, which is not really a hospital, but a quasi hospital kind of a thing. And in some cases, the doctor may want to monitor post-op, right? After sending a patient home, they may say, usually what do they tell you, right? They say come after 3 days, right? So maybe the doctor can actually put this patch on the patient and send him home and then remotely monitor from home, right? So these three are the variants that we have usually seen from what we have actually done our pilots with.
Okay. The next question is for Mr. Nandakumar. What are the products in pipeline for healthcare sector? Are you planning any other products?
Yeah, so as I spoke, earlier, from a healthcare perspective, we have the sensors, which is from an advanced sensing technology platform where we work with multiple equipments, starting from ventilators, oxygen concentrators, sleep apnea machines, and all of that. Now, apart from that, from the healthcare sector, we launched our N95 masks. We are working with air purifying respirators. These are from more of a personal protective equipment, which we continue to kind of work with various healthcare professionals to see what they need. Now, from a healthcare perspective, when I'm saying not healthcare, from a RTHS kind of perspective, this is going to be a platform where we are looking at end to end for a patient. The whole workflow for a patient is what we are looking at, and how it will help the hospital improve their efficiency. So some of the points would just, now we're looking at vitals. Maybe we also would look at saying, where is the patient? How do you track geofencing of a patient? How do you track assets which are there? Can you do future, how do you administer medicines? Can that be tracked? So all of that goes into improving productivity of the nurse or the caregiver is what we are working on. So you will see more to come as we move forward in terms of, in one of the keynote speakers spoke in the morning, right? You don't need to go to the hospital and you will not meet a receptionist for booking your bed. You ideally will be able to do it from your home. So that's another area that kind of should be work will be on from a bed management perspective. So there is a long roadmap from an RTHS standpoint. I think this is the beginning of that.
So now that the PM has launched the digital healthcare mission, what is your perspective on it?
I it's we heard about all these speakers, right? Digital is going to be the next thing, and one of the things what we are trying to do, or the government is trying to do, is digitize data of all the health records, which means a patient will be able to go into a hospital with a number, and then the doctor there can have a history which is there. So it's one of the steps towards transforming healthcare from a technology and digitization perspective. And if you look at RTHS, this is kind of playing into that, which will help hospitals to kind of use data real time and share it with multiple doctors, so that they get the data which they want to kind of give the superior patient care. So it's in line with, I think, what the government is thinking to digitize healthcare.
Okay. Mr. Ajay, implementation is always a difficult part when it comes to the digital world. It's not that telecommunication or teleconsultancy was not there previous to COVID, but we got fast forwarded into digital technology. So, how do you think implementation of a digital health mission will happen? It's
No,
a
I think
difficult task.
no, no, it's you're absolutely right. Like, if you actually ask the top CTOs and CIOs of companies in terms of what helped digitization the fastest, I think they'll all say COVID, or before that they'll say demonetization for payments and stuff like that. So big events force you to kind of do some things. Like, I mean, this particular idea actually originated from what we saw as a bed scarcity that came in COVID, right? So our smart engineers in India actually came up with this idea of, hey, you know what? Why do you actually need an ICU? Why can't we upgrade? Why don't we do something that actually solves that problem? So these kind of ideas originate from those kind of crisis kind of situations, and this originated from that, right? So very organic idea that came from that. And going forward as well, right? There has to be two things. One has to be the need. One has to be the power of the solution. You put together, you get digitization, right? So our view is we want to simplify it as much as possible. All we need is internet and the patch. Then this is going to work. Next, what you need would be, a browser where you actually do some activities, right? What you need is like simple tags that actually use an existing infrastructure that will start to make it work. How will it go to remote parts of the country? I think it will go much faster than we expect, because people who have already not invested in a lot of hardware, a lot of machines, and who are starting up afresh, will see this as an opportunity to leapfrog the digital divide and get there very fast by just using as a service software, right? So your initial investments are next to nothing. All you need is to actually pay us by the day of use, and basically your hospital is already giving top quality care by using a product like RTHS. So we are actually looking at adopters who are starting from scratch to actually adopt this and make it a way of living going forward. And we're also looking at continuum care centers who want to increase their quality of care. And then hospitals which want to elevate a regular bed experience to a smart bed experience. So you can't have an ICU with 20 beds, but you can have like 100 beds which are smarter than what they used to be before, and give them that in quasi ICU kind of an experience. So these are the three aspects in which we are actually looking at something like this.
Okay, thank you and congratulations once again. And would you like to add anything more to it?
No, I think the only thing is, how do you, the solution should help in productivity gains for the nurse giver, the caregiver, so that the person spends more time with the patient rather than doing the mundane documentation work, and attending. So if you look at the nurse call system coupled with the RTHS, will ensure that the productivity improves, which would kind of be the future for healthcare, which will give better health. And I think that's the path that we are going towards, making superior healthcare possible. Affordable is yes. So how do you give a superior healthcare? Yeah, that's
Okay,
from me.
thank you.